When a child witnesses abuse or violence in the home, parents and professionals often don't know how to help them deal with the grief. Last month, Pasadena hosted the 8th annual conference on childhood grief and traumatic loss. We have Dr. Michael Durfee, an expert and leader in childhood grief counseling, here to tell us how to reach out to child survivors of unimaginable violence. Now, we should note this might be a tough interview to watch with young children, but we thank you for being here, Dr. Durfee. Can you tell us a little bit about the conference last month?
It's somewhat unique nationally. There are other conferences on children and grief, and there's some wonderful programs, hospice programs, family support, grandma's dying, to help a child understand as well as they can. But with violent death, there's much less, and with family violence, there's almost nothing.
So why was there a need? Why do you think there's a need for the conference?
Well, LA County had the first multi-agency review of suspicious child deaths in 1978. There are now 1,000 teams in at least a dozen countries. So we've seen the forensics. How did this child die? Safe sleeping, safe surrender. There's wonderful programs coming out of it. But we haven't addressed survivors. What's it like for a child to live in a family where dad kills mom and after mom killed the baby?
So you have worked with children that have dealt with situations?
Well, I have some expertise. At the conference we had, I think, maybe the two national experts, two women from Texas, a social work professor who is the only one that has good review of the literature, who also works with the families, and an attorney from Dallas whose mother was beaten to death by her father, so she could take us there.
So in 1978, you founded the Child Death Review Team. We were talking about this a little bit earlier. Can you tell me why it's so revolutionary? It's very different.
Well, we don't do death. We don't even do getting old. We're supposed to be young and happy forever. And there's products to keep us that way. And yet the biggest events in all of our lives, if you line up 10 of them, at least a couple of them, someone you love that I love died.
So what exactly is the Child Death Review Team? And you were talking about how it's found all over the state, all over the country right now.
Oh, it's international. There's Australia, New Zealand, Canada, Europe has a few teams, domestic violence fatality review teams. What we found is that the people who manage these cases, the fire, emergency, medical technicians, law enforcement, prosecuting attorneys, pediatricians, that they were all very separate. When we met together as a team, we found that maybe 4 or 5 people knew the family, but they didn't know what the other ones knew.
So why do you think professionals don't know much about how to help people cope with grief?
Well, because we don't like it. It's this curious thing that we run away from grief, and yet funerals are the one time when people are generally nice to each other. I mean, people and families that don't talk to each other at a funeral, they will. When there was a child died in San Marino, 3-year-old girl fell down a well in 1949, early television. Yeah. And it changed the world.
And I want you to tell me a little bit about the 9th conference, the next one. When is that? That's coming up next year, right?
The next one will be again March at the Pasadena Conference Center.
Okay.
We're not sure of the date yet.
Okay.
But it's important that people do know about it, because we've had a couple people who came, I think, because they were survivors.
Okay. All right, thank you so much, Dr. Durfee, and thank you for coming with us on camera today.
Thank you very much.
We'll definitely keep an eye out for the next conference.
We appreciate that.